This video will show you how to use the Model for Improvement, which includes the well-known Plan, Do, Study, Act cycles, or PDSAs. The Model for Improvement is a simple quality improvement tool which helps us test change ideas to make sure that the ideas work and result in an improvement, as well as to better understand matters relating to implementing the idea across the entire practice. It achieves rapid results by breaking down change into small steps, and it reduces risk by starting small.
When considering changing a system, it is important to test the change first, as not all change results in improvement. In healthcare, this is even more important, as in nearly all cases we are working in a live system and cannot take the system offline, like a production, for a test. Always test change before implementation. This saves time and resources and ensures they have a positive impact.
To test an idea, you should use the Model for Improvement, which includes the Plan, Do, Study, Act cycle, or PDSA, as it is often referred to. Recording your Model for Improvement and PDSA cycles is imperative because it shows evidence of our quality improvement activities. Recording helps us to remember the steps we undertook and apply it to another topic area, as well as review what worked and what didn't. If we have a change of staff, the quality improvement activities are recorded for others to pick up and resume the work.
There are two parts to the Model for Improvement, the thinking part and the doing part. In the thinking part, we must ask ourselves three fundamental questions. What are we trying to accomplish? By answering this question, you will develop your goal. It is important to use a SMART goal that clearly states what you are trying to achieve. How will we know that the change is an improvement? This is about measurement. Collect measurements before, which is the baseline data, and after the test, ensure you can tell if there's been a positive change. What changes can we make that will result in improvement? This is where you and your team come up with as many ideas as you can.
Once you know what you're trying to achieve, how will you know whether the test has been successful or not, and what your team thinks can be done about it? It is time to test the ideas using the PDSA cycle. This is the doing part. Firstly, you need to select one of the ideas generated and develop the plan. You'll find that there will be ideas that logically should be tested first. The plan. Start by describing the idea, what you will do, who will carry it out, when will this occur, and where will it be carried out. Make predictions about what you think will happen and define the data to be collected. Remember, this should be a small test. Next we do. Carry out the plan and record whether it was completed or not. This is also a time to record relevant information relating to the test. Perhaps you notice barriers that you were previously not aware of, or unintended consequences that occurred through the test.
Study is when you reflect on what has or hasn't occurred. To do this, analyse the results from the test. Compare it to the baseline data and predictions you made, and finally, reflect on what you have learned. Act refers to what you will take forward. They are your next steps. Based on what you have learned, will you make some adjustments to your plan and test it again? Carry out the same test, however, on a slightly larger scale. Abandon the idea altogether and prioritise another idea generated from question 3. Or, implement the idea as you have demonstrated that there is adequate evidence to move to implementation. Quite often, we will need to complete more than one PDSA to fine-tune the plan before we consider implementing on a broader scale.
Be Well Health Service wants to start managing their diabetes patients more effectively. However, before they start, Dr. Smith knows that they need to create a reliable diabetes register. Dr. Smith enlists Nurse Jack to help, as he is a change champion in the practice and is always keen to assist. Dr. Smith and Nurse Jack put their heads together and use the Model for Improvement to help them try and achieve their goal. They ask themselves the three fundamental questions. What is Be Well Health Service trying to accomplish? Create a reliable diabetes register within 3 months.
How will they know that a change is an improvement? Be Well Health Service will access this data via their clinical software and the report provided by their PHN. The measures are the number of patients on the diabetes register prior to the improvement activity, therefore the baseline data, and then the number of patients on the diabetes register after the improvement activities.
What changes can they make that will result in an improvement? Dr. Smith and Nurse Jack consider the following ideas. Generate a report to identify those people with an unknown type of diabetes. Manually check 20 random records to see if coding is accurate. And generate a report to identify people on diabetes medication that are not coded as having diabetes and code correctly. Now Be Well Health Service is going to test one of their ideas with a PDSA cycle. They decide to test the third idea.
Plan. On Wednesday morning of this week, Nurse Jack will generate a report from the Clinical Information System and review the data with Dr. Smith on Friday. Do. Nurse Jack generated reports on Wednesday morning. It was a little harder than first thought, however Nurse Jack and Dr. Smith did review the results as planned.
Study. The report only listed 226 patients coded with diabetes, and this was well under what Dr. Smith was expecting. Nurse Jack also produced a report which listed that 500 people over the past year were prescribed diabetes medication, yet only 226 were on the register. It appears that Be Well Health Service has a data quality issue which needs to be resolved. Act. Nurse Jack and Dr. Smith agree that action is required. They ask themselves again the third fundamental question: what changes can we make that will result in an improvement? They come up with further ideas, such as bring up at the next clinical staff meeting the need for a reliable register, as well as how vital it is to consistently code patients. Other ideas are that they will ask the GPs for their ideas around this and place sticky notes on the computer screen to remind GPs to code diabetes. They decide to have a meeting with all the GPs to discuss the register and see whether they have further ideas.
Over the next couple of months, Be Well Health Service focused on improving data quality and establishing a reliable diabetes register. It took quite a few ideas to achieve this, but the outcome also had an impact on other disease registers as GPs started to code routinely. Once the chronic disease registers were established, the team decided that the next goal would be to focus on improving the care for people living with diabetes. The model for improvement is an important tool to help implement sustainable, systematic change.